I can't hear you. Can you guys hear me?
Yes.
Okay, good. Hello? They said, can you guys hear me? Hmm. My mic is on and I'm not on mute. And I can hear you and somebody answered a second ago. My mic is on. Hold on one second.
I'm the other person. I'm not in the BML. Probably they are muted.
Yeah, I'm not, I can hear you well. Can you hear me?
Yes, I can hear you. So probably they are muted in the board.
Okay.
In the board, probably. Probably they can hear us right now.
Sorry about that. Cost me $1,300. I had to schedule it and I went and they paid me $30, but I did it. And there were two questions.
I think now I can hear the room. Can you guys hear us?
Thank you.
Great.
Okay. Dr. Hushan, I'm Dr. Ann Ray. I'm president of the Mississippi State Board of Medical Licensure. This is our executive committee meeting. Dr. Michelle Owens and Dr. David McClendon and Ms. Morris, who's represented from the Mississippi Attorney General's office. Good afternoon. And we're here because you've made an application for licensure. And let's see. What we don't have is a examination of medical proficiency within the last 10 years. And I'm going to give you an opportunity to speak to your application process and why we need to waive you on licensure.
I'm actually participating in the MOC, but I have not taken the exam. So you should have a letter from the ABIM within the file stating that I'm participating, and I've signed up for the exam this summer. Do you have that letter?
Before tab 2.
Mhm.
Yeah. Should be the last page.
Okay, have you scheduled this exam?
I scheduled the exam for the summer. It's not like I have to do it myself, so I'm scheduled for the summer. At this point, it's July. Um, it's 80-20, so you get 80 points by doing the MOC, which I have 100 credits of those. But then I still have to have the examination to get the recertification.
Okay. And where are you practicing currently?
So right now I'm practicing in Chicago and in Atlanta. And I have been seeing patients in the hospital up till June of 2019.
Okay, but you're currently practicing on a daily basis now,
Correct.
in a clinic setting? An
So we,
office?
sorry to interrupt. Yeah, we actually have a home-based geriatrics primary care. So we go to patients' homes, and that is the actual clinical model that we're going to bring to the Mississippi area, where we have a team of providers, myself included. We would go see patients in the home setting. So at this point, I'm practicing in the home setting. I do home visits with patients, and I also have few visits in skilled nursing facilities.
So what's your motivation for the Mississippi license?
Once again, our group is coming to Mississippi. Our group's called WellBe Senior Medical, and we would like to start seeing patients in the Mississippi area.
Okay. Are other members of your group licensed here?
I'm sorry again?
You say you're part of a group. Are other members of your group licensed in this state?
I think I'm the first one that applied because I'm the chief medical officer of the group. So I'm the first one that applied now, but our goal is to probably, after I get my license, we will hire local physicians to help us with that. So the short answer, I'm the only one applying. I'm not licensed yet.
Okay. Is there some reason to waive your application now when you're scheduled to take your exam this summer? What's the imperative here?
Would like to get the licensure now because we're trying to actually get the LLC developed, you know, how we put the corporative medicine practice. So it needs a licensed physician to start that process for us.
But meanwhile, you're practicing where you are,
Correct.
making a living, and all people in your group are.
Correct.
And I know you'd like to start your business plan and all that, but other than that, what are the disadvantages of waiting until you take your exam?
It's again, it's going to be a big delay, and we have contractual agreements with health plans to fulfill.
And where will you be going?
I believe, again, I'm not very familiar with Mississippi, but Jackson, Mississippi, and there's one other area that I can't remember now.
Okay. Any other questions?
I have a couple. So you mentioned that there's a team of providers in your practice model, but you are the only person who's seeking licensure here. So what exactly is your practice model like where you are? Is this an entirely physician group? Is this a physician group that collaborates with advanced practice providers? What's your model and how does that work?
Yes. So the model of care is we have community medical directors, and normally are hired, they're local physicians licensed in the state. And we collaborate and work with advanced practice clinicians, nurse practitioners, and PAs. We also have LCSWs, we have care team coordinators, MAs, LVNs, and nurses that manage the patient at home. So it's a combination of physicians and providers, APCs. Now, the main reason why I'm kind of spearheading is, again, I'm the chief medical officer for the organization. So for us to get the company structured, so we're able to, if you will, get an entry into Mississippi, that's how we start. But then we'd like to hire local physicians who know the area and know the population versus implanting other physicians. And so the providers in our group now, they're mainly between Atlanta and Chicago. That's where they're practicing today.
Who are you contracting with?
For it'd be WellCare.
Healthcare? And
Is it similar to Landmark with Humana that has presented to us before in terms of just their model?
It's actually, I'm sorry, it's very similar, in a way, it's similar to the Landmark model, but yeah, I think that's the closest I could compare it to, correct.
I know in certain situations we make exceptions, but I believe, at least I know of one case, I was not on the board, but of a similar situation where there was a physician who was actively practicing in Alabama, but he hadn't taken his boards in over 10 years. And so he never was able to get a license. He was older and just said, I'm not going to sit for my boards again. Permission was not given. But he was a good physician, good standing in Alabama. Again, that was a personal understanding of that case. I don't know the deeper aspects of it. So I guess I'm just curious about the precedence of this type of situation with the board.
I think the point, it sounds like it's just the concept. That's why they are reviewed, I think, case by case. And the rationale or the reason why, which can be highly variable, I think are going to vary from individual to individual. So if you, I mean, it's kind of easy from an administrative standpoint. They either meet criteria or they don't. And if they don't and they want to be reconsidered, then having the opportunity to at least provide the background information that they feel is pertinent to help us make that decision or to determine if that is the right thing, I think is reasonable. I don't know that, I mean, since it's all case by case, I don't know that there's really a set precedent per se.
our question forward been with Landmark and their business plan. And they were actually seeking physicians without licensure to collaborate with nurse practitioners here.
I think that was kind of part of my
rubbed us
question.
raw.
Well, and that was kind of really my issue, the question, if there's one person from this group who needs a license in order to set it up,
They need
But-
all of them to be licensed.
but the remaining individuals, if they're all going to be from Mississippi, if they're coming from somewhere else. And then the other, my concern was just also like, what are the plans going to be for collaboration as they exist here, which can be different than they are in the state of Georgia and different than they are in the state of Illinois, and the accountability for that too, and making sure that those
Yes.
are adhered to, et cetera.
Yeah, I think our discussion with Landmark previously been over the supervision collaboration with the advanced practice nurses and whoever, and they did not, they originally were going to do it without doctors who were not licensed here.
Correct.
But, and I think,
They are hiring
I'm
doctors.
sorry.
tell me, Stan, Mr. Ingram?
Yes.
Oh.
I'm thinking in time past with groups that come in, don't we require all the members to become licensed in the state? Of a group that's going to set up business here, physician group. Don't all the members need to be licensed? Or absolutely, so all of the group would have to be licensed, not just one.
Mississippi, they are.
Right,
What's the circumstances under which they would not be practicing? If they could be an owner, but they're not necessarily practicing in this state, they would have to have a license.
right.
So that
So
would mean that nobody else would be able to establish, whether it's a collaborative relationship or any of those things. It can't be done on behalf of the entity. It has to be an individual physician relationship
Yeah.
that exists. And that,
well, if he's the president of a group, the entire group, being the business entity, needs to be licensed.
Correct. Now, can I chime in, if that's okay?
Certainly, go ahead.
So the main purpose where I would get the license is just to set up the corporation, if you will, because you have to have a physician who's licensed in the state to set up the business. But every other single provider that we will be hiring will be licensed in Mississippi. They're going to work with all the regulations to make sure they work with the exact number of collaborating APCs, MPs, MPAs, and follow the regulations to the T. That we actually hold that very high on our list of making sure that we're compliant with everything we do. So again,
Right.
being
So those are the employees. Those are the employees, but who is going to be on the board of this corporation that you're going to set up?
the board,
If you're the president of the corporation, who's the vice president and secretary?
so I'm the
Who
chief.
else has money in it?
I'm the chief medical officer. We're actually supported by Venture Capitalist Group, and that is the board, and support the entity financially.
By way of clarification, this board, of all a number of other licensing boards, adopt what we call the corporate practice of medicine policy, which means this board does not concern itself with the business arrangement which a doctor enters into. He can work for, he can be an employee for a hospital, or he can work for a clinic that's owned by a group of non-physicians, with board directors of the corporation, and so forth. The only exception being pain management clinic.
Okay,
So what the doctor is referring to is that they form a corporation, maybe physician owners, maybe not physician owners, but the ones who treat patients, the site of where that, for the purpose of licensure, it's where the patient's located.
mm-hmm,
If a
right,
doctor from Illinois treats a patient in Mississippi, he has to have a license in Mississippi.
right,
So it seems like he's more requesting an administrative license that he didn't technically apply for because he doesn't meet criteria currently until he passes his boards. And if all of these that he's needing is just the administrative license to get a sign off on all the insurance forms, that's the more, seems to me the more appropriate avenue.
Yeah.
To fit still within our regulations, but still he gets hopefully what he wants.
yeah, because at this juncture, I have still yet to hear a valid reason why we need to waive the licensure. Like, I'm not seeing any of the reasons why I think it would actually really justify waiving the regulations just for the sake of allowing him to be able to move
Yeah.
forward with setting up.
Yeah, what's the
There's
hurry?
another pathway. And then, I mean, there's a plan in place. When those things are completed, it works for me.
Mhm.
But that actually may be a better option.
Doctor, are you aware that there's an administrative license, a separate licensure entity with the Mississippi Board?
No, I was not aware. I have, all the other license that I have, you just apply to a regular license. So if there's an administrative one, maybe we could apply to that.
that would allow you to set up the corporation and different things, but it wouldn't allow you to practice in Mississippi. So if you're going to actually get started practicing and demonstrating the model yourself, you need a full license.
And
And
okay. Now back to,
Purpose.
yeah, I just heard about the valid reasons, because when I read in the denial letter that I got for a license, it's not only not having, being recertified, it was, I was not participating in the MOC. And that's why I actually requested from the ABIM to prove that I am actually participating in the MOC.
Okay, for those of you who are. That's a little bit different wrinkle. All I know is when I applied to Alabama, they said, you're gonna take this test.
I mean, the bottom line is he hadn't passed the test in greater than 10 years.
Right,
And-
and that's what the regulation's about.
Right.
And the only question that I really heard was, oh, is this a justifiable cause for us to waive that regulation, considering why it's in place? And for me, I don't know that, I'm not.
I don't
Really
think
big.
that's justified.
Yeah,
It's
I
only
just
6
for the
months.
consideration of the board, I think, the model of care that we bring to the area in light of COVID, there's been a lot of folks would actually make certain exceptions to ensure patients are treated, they're treated in the comfort of their home, and they're not going to unnecessarily being exposed to facilities, if you will, ER, urgent cares, and even primary care visits. I think we bring great service to the area, and I believe that should, hopefully it's a great valid reason to make an exception.
I understand your motives. I think the model that you're bringing, though, also is harder for us to scrutinize as a board than, say, an office or a hospital practice. And our primary concern is taking care of Mississippians. And I don't see a great imperative to waiting 6 months and getting your exam passed. Shoot, it's already 20th of January and it's flying by. So 6 months will be gone in no time. You've already got the test set up. The requirement is for you to have a test.
Yeah, but everybody here knows that I'm going to take the test, but I have to pass the test, which is a different story, but that's okay.
Well, I
told-
had to do that for Alabama too, and other states have the same. There are some other states with the same requirements, and that's requirement.
I would just add, we don't know that you're going to take the test. We know that you have scheduled the test,
Mm-hmm.
but that doesn't assure us that if we went ahead and gave you a license today, that you would actually follow through with taking it.
Exactly.
So,
And do I have a motion?
I make a motion to not approve
Second.
his request for a permanent Mississippi license.
Second.
Motion second to not approve the waiver of the license requirement and grant licensure. All in favor?
Aye.
Aye. Any opposed? No. Get your test under your belt, and we'll be looking forward to seeing you back.
Excellent. Thank you very much for all the consideration.
You're welcome.
Thank you.
Thank you. Second on our agenda is matter concerning Lampros Papademetriou, MD. Did I say that correctly?
Yes, ma'am. Me too, yeah.
Okay.
Here's my mask, but I'm at my office, so
I think we're socially distanced. I'm not
Yes.
worried about you.
yes.
Okay. You have sent in a request for Mississippi license, and the but the problem was, international medical graduate students not complete 3 years of ACGME approved postgraduate training in the United States or training in Canada. And we're going to look at your information, and I'd like for you to state your case.
Yes. So thank you for letting me appeal. Since I'm not, meeting the official requirements. So first of all, I want to state that this is happening. So I'm working as an advanced heart failure physician at UMC. I did my fellowship, the advanced heart failure fellowship, the 1 year in 2018, and then I continued as a faculty here. So currently I have a limited institutional license, which we thought that it was okay. However, a few months after practicing as a faculty, when our nurse practitioners went to recertify or something, it came up that because I didn't have unrestricted medical license, I couldn't supervise them. And that's a big problem for our group here at UMC. You know, we are the only program in the state with transplant, heart transplant, advanced heart failure. And we have these two nurse practitioners who are, the backbone of our team. Those are the main medical healthcare practitioners that round and take care of our sickest patients. So, of course, we complied, definitely. So we came up with a work around process, which is when I am on service, it is weekly service. I see some patients with the cardiology fellows, and the nurse practitioners see some of our patients with another attending physician. I still take the calls, the night calls for all the patients. I still take the calls for donors, heart donors. I still take the calls on the weekends, because on the weekends we don't have the nurse practitioners, we have the cardiology fellows. So as you can imagine, this causes, okay, it can be done. It causes, though, a lot of stress to the system, and especially for the COVID, not because of the patients, but because of the doctors. Okay, now with the vaccination, we did the vaccination, hopefully it's gonna work. We are not gonna have this type of issues. However, in this week, currently, I am on service, and we still do the same thing. So the nurse practitioners with another attending, they are seeing few of our patients, and I'm seeing the rest. So the main thing that I'm asking the license is this one. So if there was, let's say, another way of getting me the waiver to be able to supervise the nurse practitioners, PAs or whatever other practitioners, I would be okay with that. That's my main purpose of applying for the full medical license. Of course, since I had the 1 year of the advanced heart failure, the rules of the ABYM changed in 2017, I think 2016. Up to that time, if you had done 1 year of accredited fellowship, you were able to give the boards. After that, they changed it and they said, in order to give boards in a subspecialty, you must have the cardiovascular disease first. So since 2017, I was not able to give the boards for the advanced heart failure. And as you said, I will be able to give the boards for the internal medicine in a year and a half from now, when I have completed 3 years as a faculty at UMC. At that time, if the chair of medicine agrees, he can we can send a letter to ABYM, and you know, they will consider me giving the boards and starting, you know, giving the boards internal medicine, then cardiovascular. So that's the practical part. So the typical part is, okay, I think, you know, that I'm both qualified clinically and academically. I think, and the nurse practitioners and the students already and the fellows, you know, I teach, I educate them, but even the nurse practitioners could learn from me and I could learn from them as well. You know, I've been trained in Greece. 2011, 12, I got my license in cardiology. My license, I got it from 1999. So I have academic, I have done a lot of research. I have several publications. I'm involved in grants here with Dr. Fox, with Dr. Butler. So I like Mississippi. I want to work for the Mississippians. I try to help, going to Jackson Free Clinic, you know, I try to help wherever I can with my, you know, 2 hands that I have. So that is my case, you know, and thank you for considering you know, this appeal.
Thank you for that. Dr. Cleveland, help clarify something for me. With a institutional license, is he allowed to collaborate?
No.
Okay, so that's where the rub lies. Doctor, what is your exact position now with the UMC? Are you considered a resident or
No, I'm a
an
faculty.
assistant?
Faculty. I'm an assistant professor.
Okay, so faculty. Okay. And so the boards you're planning to sit for, the cardiology boards here in American Board of Cardiology here?
So the plan is I have to take, so again, as I told you in 2000, if it was 2017, I would be able to give the boards. Now I have to start from the internal medicine, and I want to do that, but in order to be eligible to give the internal medicine boards for starters, I have to be 3 years as a faculty at the same institution. That is the, you know, I have sent you the pathway EA for international medical graduates. So I've been faculty since July 2019, 1.5 years. So in order to be able to give the boards, I have to wait at least another 1.5 years.
Okay.
And yeah, that, as you can imagine, it's not the best again. And for the, you know, and for me, I'm not feeling well because I'm pressing and I'm placing a lot of burden to my colleagues, because now there has to be a second physician that has to round, let's say. It is, you know, it's not the smoothest thing. Of course, my colleagues, they are okay with that. They say there's no problem, but you can imagine, okay, and I appreciate that, their help and their assistance. But
Is there is there a subspecialty area you're working in currently?
With heart transplant and advanced heart failure. With I see all the patients that we see here at UMC, all the patients. Heart transplant, advanced heart failure, with LVADs, all of them. Before it was Dr. Moore and Dr. Long, because Dr. Moore especially has to be a figure in Mississippi. So now, you know, it was me and another two physicians came as well on board.
Okay, so you're between a rock and a hard place, as we say down here. Dr. McClendon.
Madam Chair, this doctor has a letter from Dr. Butler, the Department Chair of Medicine at UMC, and Dr. McMullen, I would consider one of the most highly respected cardiologists in the state, supporting his licensure. I see no reason to disagree with their letter.
Yeah. And I remember we did set a precedent. We had a professor from England who came to the university, who was preeminent in this field. All his training was in Europe and in England, or the United Kingdom. And he had over a couple of hundred articles published in his name and other accolades and different things like that. We brought a great deal of expertise. That's the reason he was wanting us at the university, and we waived the license for him. And what you think?
I just had a couple of questions. As far as
Go ahead.
So, did you come to Mississippi originally just for training? You came as a fellow?
Yes.
Is that why you came here to begin with?
Yes, I came here as a fellow, and to tell you the truth, okay, my mentor is Dr. Butler. So I've been working with him since when I first came in US in 2012. So he's my mentor. We are working together. But nevertheless, yes, I came as a fellow. I was here. I was doing clinical research the previous years in US. I have reached up to the level of assistant professor as well in research. But then, you know, I always wanted to do clinical medicine. I love clinical medicine. That's why I came to US to work as a physician. So yes, I started as a fellow, an advanced heart fellow. Yeah.
And is there any pathway now? So when the requirements changed in 2017, that kind of closed the window on your opportunity for the cardiology piece. So I know that you're going to go back and do the internal medicine part, which is actually quite admirable, but it does at least check off a box for you to have your board certification. Is there a pathway that exists, and it's just really for my own information, for you to get to your board certification in cardiology? Like, if you got your internal medicine boards, if you're working is there a process or a pathway that would enable you at some point to be boarded in cardiology?
Yeah, so from other colleagues of mine in other states, they told me that the main problem is the board in internal medicine. After I get those boards, then I don't have to spend, you know, specific amount of years. I just have to send to ABYM a letter, and then they can give me permission, let's say, to give the cardiovascular disease boards and then the advanced heart failure. So the main problem, let's say, is to get the internal medicine.
I don't have anything else.
Have a motion.
Make a motion to approve Dr. Papa Dimitriou's application for a permanent Mississippi medical license.
Second.
All in favor?
Aye.
Aye.
Aye. Okay. Well, doctor, we're going to grant you the waiver and give you full licensure.
Thank you very much. Thank you. Appreciate it. Thank you very much.
I think you qualify as kind of a special situation of need there, particularly at the university. So good luck on,
Thank you. I appreciate very much. Thank you. Thank you.
all right, you'll receive a letter. Thank you. We have anything else on this agenda?
Motion to adjourn.
All in favor? You going back to work? Are you shopping or what?
I wish.
Well, you know,
I can't go back to work now.
I've got in Columbus, Mississippi, you can't